For most people, hospitals are places of healing, but in Pakistan, a government-run hospital has become the center of a growing public health crisis. At least 130 people, most of them children, have tested positive for HIV after receiving treatment at a hospital in Karachi. The outbreak has raised troubling questions not only about one medical facility but about the country's healthcare system as a whole. The focus of the investigation is Karachi's Baridhara hospital, where an unusual cluster of HIV infections among children first came to light late last year. Official inquiries found serious lapse in infection control, including poor compliance with safety protocols, inadequate use of protective equipment, and improper handling of single-use medical supplies. Authorities have issued show-cause notices to 37 doctors and hospital staff, with criminal proceedings expected against those found responsible. But is this simply the failure of one hospital? Public health experts believe the problem runs much deeper. Similar outbreaks involving children have been reported at several hospitals across Pakistan in recent years. The World Health Organization and UNAIDS have also identified Pakistan as one of the fastest growing HIV epidemics in the WHO Eastern Mediterranean region. Experts argue that the crisis extends far beyond the quality of syringes. Weak infection control practices, poor regulatory oversight, and limited accountability remain persistent challenges across hospitals, clinics, and private healthcare facilities. They also point to a long-standing culture in which many patients expect injections as part of treatment, increasing the demand for procedures that may not always be carried out safely. In response, the Pakistani government has announced a nationwide crackdown on substandard syringes and plans to introduce mandatory HIV screening before surgical procedures. Authorities have also established a dedicated fund to support the long-term treatment and care for affected children. 𝗞𝗲𝘆𝘄cie𝗿𝗱𝘀, Daily Sun.